In the year 2019, on a cold January afternoon, I had a pregnancy test at home. I remember feeling anxious and giddy as I looked down at the kit. I was pregnant for the very first time. Within the following week, I visited a doctor. At the hospital, it was confirmed that I was pregnant. They took some tests to check my vitals, besides also taking antenatal routine blood screening for syphilis, hepatitis, and HIV. I was also given a dose of tetanus toxoid. They also gave me antenatal drug supplements. Later that day, by the time the test results came in, a counselor of the hospital called me. She ushered my husband and me into her room. There, she broke the news that I had HIV. She continued explaining about the services available, but her voice slowly became indistinct as I saw the future that I had built come crashing down in front of me. It took us some time to absorb this fact. It was very difficult to accept the reality. They explained about the treatment of antiretroviral therapy or ART and how it improves health and prolongs life of an HIV-positive person. They also said that taking this would reduce the risk of HIV transmission to my baby during pregnancy, delivery, and throughout the breastfeeding period. With everything going downhill, it was hard to believe in this possibility, but what choice did I have? I promised myself that I would hold on to this flicker of hope, like I would hold on to dear life. Soon enough, I started my lifelong ART routine. Going to the center, they did some tests to find out my CD4 count, virus load, and clinical stage. But these tests, I was told, would not determine my therapy, as it is mandatory for every HIV-positive person to take ART, irrespective of CD4 count. I was further counseled on nutrition, rest, institutional delivery, breastfeeding, and HIV-specific advice. It was during this very low period of my life that I found a new friend in my husband. Most days, it was the support and care that he showed that pulled me through. Soon, the second and third and fourth antenatal checkup came. As I went for these regular visits, I realized how important antenatal care was to ensure safe pregnancy and delivery for me. I also realized that this care, doubled with ART, was serving as a strong foundation for a healthy baby free from HIV. This was a joint effort and management of both my HIV care team and my obstetric team. As my due date approached, the thought of delivery and how my life was about to change made me feel nervous on some days. But deep inside, I remember feeling a sense of contentment and calmness. When I hit rock bottom, I bet my life on the ray of hope that I took confidence in. I knew I was on the right track now. I had dutifully and consistently followed all 4 visits of antenatal care, taken all prescribed medications and vitamins, adhered to taking ART drugs regularly, and followed all necessary advices given. On the day of the delivery, as they pushed me into the labor room of the hospital, I knew I was in safe hands. I knew my baby was in safe hands.